August to our August quarterly meeting. My name is Fred Lyda. I'm the Human Services Director for Beaufort County. And what I think we're going to do is, since we have about 23 people who are logged in right now, I'm going to just ask each of you to go in the chat box and list your name and your organization so we can make sure we capture everyone who's present, so you get credit for participating. And then we have two people by phone. I can see an area code 602 and an area code 989. If the two of you would just tell us who you are, because we won't have it in the chat.
Good morning, Fred. This is Maggie Young. I'm the 602 number, and I'm from the MUSC Boeing Center for Children's Wellness.
Great. Welcome.
Thanks, Fred.
How about our 989?
Yes, this is Bob Elliott, representing the South Carolina Nurse Retention Fellowship Program.
Great. Welcome. All right, I'm going to give it a minute for everybody to get their introductions on the chat. If you would open the chat window so you get a chance to see who else is present in the room. And we will, as we have been lately, we'll give some time at the end of the meeting if anybody wants to stay on board to have an opportunity to have a sidebar conversation with any of the other attendees. We'll leave the window open so you'll have that opportunity. Because I know that one of the best outcomes of our gathering like this is some of the connections and information that gets traded back and forth between members during our meetings. So we want to continue to give you that option. All right, I think we have most of the folks that are present have now made a introduction in the chat. So you're welcome to scroll through that and see who your colleagues are who are attending this morning. And then I'll just get into the Alliance news and updates. So probably the thing that's most on folks' minds is, where are we with the money? The community services grants are all been received. We got a little over $1 million worth of requests. And as you guys know, we have less than 500,000 to give away. So the review panel is going to have a tough job dwindling that down to a manageable amount. But they're going to be, they're in the process of being reviewed now. We expect to have the announcements for the awards by mid-October. That'll be following the county council meeting, where we will get approval to be able to move forward with that part of the process. I think the other big announcement that we have that's been happening is the formation of a new Together for Beaufort County work group. This one is going to be targeting, or is targeting, housing insecurity. Anna, can you give an update on the REC?
Yes. Hi, good morning, everyone. So the coalition that was, and for some reason the name is eluding me, Residential Empowerment Coalition. I always freeze when I'm on the spot. But we voted, so there's over 20 organizations and representatives who have joined this coalition. That was the name that was voted on. We have come up with a mission statement, which is: the coalition reduces homelessness by facilitating collaboration amongst organizations and enhancing partner organizations' capacity to provide comprehensive residential supports. And then a vision of Beaufort and Jasper County residents are empowered with tools, resources, and support necessary to access safe and stable shelter. And we are meeting twice a month. I believe it's second and fourth Wednesday of every month. to start providing these services to our community.
And the upcoming agenda?
We also have, yes, so Heather Carver, who is the director, the program director for Continuum of Care, which is directly through HUD. She will be presenting on homelessness at our next meeting, which is next Wednesday.
Right. She's going to be focusing on the point in time count, which, as most of you are aware, is a federal mandate that happens every year in January, where each community in the nation tries to get an assessment of the total population of homeless individuals in your area. Several of you have participated in this count in the past, so we are hoping that you will come back to the table and be willing to assist us again in this next year. But Heather's going to be going over the details of that process at that next meeting. All right. I think the only other thing that we have is to give our introduction for Ben. So let me just say that we apologize for the technical issues that happened at the last meeting. We realized that it wasn't as informative as we were hoping because of the technical issues. So we have a presentation that we prepared for you. This was actually originally prepared to give to County Council so that they would have an update on the issue. And ultimately, it led to the council giving us permission to add a new position, Anna's position as an outreach specialist, so that we would specifically have someone focusing on this population and the issues that we have in our community around it. So this presentation, I'm asking Ben to go slow because it's got a lot of really good information. So please pay close attention to the process or the information that he's going to be giving you. Ben? Ben, I don't know if you're talking, but we can't hear you. I can see it's toggling between mute and unmute, but we still don't hear you. And we even tested this before we started.
How about now?
Yep, can hear you now.
All right. Yeah, sorry about that. Zoom decided, oh, I'm going to swap to a different microphone, one that's not hooked up. So, yeah, I was talking like 5 minutes ago, so I don't know.
Hold on.
I feel like we're just cursed with this presentation. So anyway, I apologize, and I apologize for how the last presentation went. Good morning, everybody. So this presentation, as Fred said, we gave it to County Council a while back, and I have added to it bit by bit over time in response to feedback, questions, concerns, and other things that people have brought up as we've given it. And we've given this presentation 5 or 6 times now to different community groups, public groups, partners, folks like that. The major goal of this presentation is to just get everybody on the same page using common language with a common understanding of the issues that we're trying to address, the challenges we're facing, because there is a lot of disparate information. And I think one of the frustrating things, and I'm going to address this in the presentation, is that a lot of the disparate information, all of it is still correct within its respective context, depending on what you're talking about, how they have defined it in the data that they're presenting. So you can have lots of different numbers, and they can be totally different, and they can all still be correct.
And
So
your PowerPoint's not showing up. Can you share screen? There we go.
we're all set?
Perfect. Yep, you're on definition of
Yay, okay, it's moving. All right.
Okay.
So yeah, definition of terms. What we're going to do is align ourselves with the HUD definition of terms, and they have 4 overarching categories. There's homeless and imminently homeless. I'm not going to define those. I'm pretty sure you guys understand what that means. But there's two other categories as well. So there's victims. These are the folks that Hopeful Horizons worked with, individuals trying to flee violence, sexual assault, stalking, other situations like that. The fourth category is the one that really throws people off. So it's federal statutes. And what that means is that if another federal law defines someone as homeless, HUD will also accept that as a homeless individual. The only example I could find, and this is probably one that some of you guys will recognize, is the McKinney-Vento Act. So McKinney-Vento is an act by which schools are required to, for someone who self-identifies and approaches a school district or a school social worker or school counselor and says they're going to be displaced, the school tries to maintain that child in the school despite the nature of their displacement. In articles that have come out, it says that there's about 300 children who are homeless. There are 300 children who qualify for McKinney-Vento, and there are 300 children who are displaced or otherwise in some sort of less than ideal living situation, but it doesn't mean that they are completely homeless or unsheltered. They can be displaced and still qualify for McKinney-Vento. This is probably going to be something you're going to see coming up with the, what's the name of the apartments again, Fred, that they're just getting shut down?
Oh, the Chimney Cove.
Chimney, I want to say Shelter Cove. I'm like, it's not Shelter Cove. Chimney, I know it's something Coves, Chimney Cove, So if all of those families were to relocate, say, to Jasper, I believe they said there's about 70 children who are in county school districts. What they could do is identify themselves to the school, and they would arrange transportation in coordination with Jasper County School District to get those children to the school they go to now, which means they would send a bus out to toward Jasper. Jasper County would send a bus. They'd meet up, transfer the kids, and get them to their school so they can maintain some degree of stability. So yes, there are 300 children who qualify for that. A lot of people freak out and they think that there's 300 children who are just completely unsheltered. But they actually broaden, in the context of that federal statute, broadens the definition of homeless to include displacement and other situations like that. Further defining the terms, homeless, you have two categories there. There's sheltered homeless and there's unsheltered homeless. So sheltered homeless are individuals who are in emergency shelters or transitional or supportive housing. And then your unsheltered homeless individuals are people living in cars, parks, sidewalks, abandoned buildings, or are otherwise just on the street. Further defining that, you have chronic homeless. And chronic homeless are people who are experiencing some sort of disabling condition, and they have been continuously homeless for a year or more, or they've had at least 4 separate episodes of homelessness in the past 3 years. And typically with people who are chronically homeless, you see substance use disorder, serious mental illnesses, developmental disabilities, chronic physical illness or disability. And that can include the co-occurrence of 2 or more of those conditions. I also want to take a minute to talk about urban versus rural homelessness. Only 7% of the nation's homeless live in rural areas, which means 93% of homeless individuals are in the cities. Unfortunately, this is also reflected in funding for homelessness because 93% of the funding for homelessness is in the cities. So I know that we all recognize that there are challenges here, but anybody who's seen pictures of the homelessness like in California understands, just how extreme that situation is. We're talking tents in the medians of highways. So in some degree I understand. And the nature of the homelessness and the poverty in those two areas is very, very different. Typically with rural poverty or rural homelessness, you see persistent poverty. Now, a persistent poverty is classified for counties that have had high rates of poverty over a long period. And what that really means, we're talking about generational poverty. We're talking about people who have lived in poverty their whole lives, and they grew up in poverty because their parents lived in poverty their whole lives. And that changes the nature of your interventions, because if that's all that population knows, it's not like they're clamoring for the kind of services you might see in an urban environment. So there's a different intervention that you would implement there. You see patterns like this. So Silicon Valley is the example I just gave, where you see rapid economic growth that pushes a lot of people out. And then you see rapid economic decline, like the Rust Belt areas, where entire industries just collapse. So those will actually generate counties experiencing persistent poverty. And interestingly, 64% of rural counties have a high child poverty. So rural poverty seems to disproportionately affect children more than urban poverty, or urban homelessness rather. And we all know, there's limited rural capacity, lower median income, limited transportation, and then of course low priority funding. In terms of addressing issues of homelessness, a lot of folks look at homelessness as the issue. We have to fix the homelessness. But when you get right down to what it is that you're trying to address with the individual, the homelessness is certainly a problem, but the treatment for that is going to be very, very different depending on the nature of what the individual is experiencing that led to their homelessness. And so I'm going to run through symptoms and these are in no particular order of importance, but these are ones that are pretty common that we've seen. There's a couple other that are less common, and I'll talk about those as well. And I'm sure everybody can relate to this, and anybody who's worked in this field knows that there's a lot of folks who are homeless who have some sort of challenge with mental illness or a history of trauma. And I specifically use the PTSD graphic there because PTSD would be a trauma-related concern. And your interventions in that situation, we're talking about psychiatric care, transitional housing, if that's a condition that can be treated. But depending on the severity, you might be talking about permanent supportive housing. Permanent supportive housing being a transitional housing style environment, but you've got somebody who is persistently checking in on these folks. And there's different models of permanent supportive housing. And they range from, like a nursing home style model all the way to just a transitional housing or apartments where you have case managers checking in on a daily basis with the folks, making sure folks are taking their medicine, making sure that they're safe, they're doing okay. Substance abuse, and typically you see this co-occurring with just about every other episode of homelessness. In these cases, you're talking about addiction treatment, transitional housing. Luckily, there are a lot of housing opportunities for folks. The challenge being, of course, that you have to be dry or attempting to get dry to qualify for some of those like halfway houses. Residential treatment facilities, if you need medically assisted treatment, there's opportunities there. So there's opportunities to help individuals experiencing concerns with substance misuse. This is one that doesn't come up very often, but the community responds very, very well. I think it's a bigger issue when we come around to hurricane season. If there's a fire or natural disaster, fires, what we see in terms of fires generating homelessness is individuals who have inherited a home and the home has been paid for. And there's times where they say, well, I'll just save a couple $1,000s a year and I'm not going to pay home insurance because my bank doesn't require me to. I own it and it's fine until it burns down, and then it's not fine. It's very unfortunate. Other concern we have, and this is one that came up after Hurricane Matthew, is anybody who has experienced any sort of damage to a hurricane had a wake-up call about how hurricane damage is covered by insurance. There's a different deductible for some sort of a damage related to a hurricane, it's usually 3.5% of the deductible for the damages incurred. Anybody who knows about the vet in Port Royal after the last tropical storm, they got hit by a tornado. They had just completed a new renovation. They had $1 million worth of equipment in the room that got hit by a tornado. And what that resulted in was a $35,000 deductible, is 3.5% or 5% of, and I don't know what their insurance, but it's somewhere. My house is 3.5%. It can range between 3.5% and 5%. So even though they were insured, they still had to come up with $35,000 to $50,000 to replace the equipment in that room, which was pretty devastating because no one's got 50 grand in the bank ready to go. And we saw this a lot in some of those gated neighborhoods. You're talking about senior citizens who were in their 80s. Their only asset is their home, and they might have $1 million home, but if it's experienced catastrophic damage, like a tree down the middle of the home, they are not going to have the liquidity to deal with that. And they certainly can't sell the home now because it's been destroyed. So those were some of the challenges we experienced related to hurricanes. And hurricanes are just going to be an ongoing concern. Economic pressures, we're talking about job loss, low wages, global economy. This one is one that you can only really react to. There's nothing you can do to influence this. There's nothing we can do about the global economy. Not a whole lot we can do about low wages. There are opportunities here, financial counseling, vocational rehabilitation. If their job loss is the result of like an injury or some sort of disabling condition, there's opportunities to intervene there as well. Violence. If you are a victim of violence, there's opportunities. Usually intervention there is law enforcement, domestic abuse shelters, victim support services. We have those through the 14th Judicial Circuit, and there's transitional housing opportunities there. This is one that I just learned about within the last few years working with the detention center. They actually exit a lot of folks from the detention center into homelessness. They're homeless when they went in, or the process of them going in, their family might decide, yeah, we don't want them home again. So they're exiting. They might enter with a home, they might be getting out without one. Your interventions there, justice system. Hopefully, depending on the nature of the infraction, there could be opportunities for the justice system to provide some interventions and support services. There's reentry services that you can work with an individual to try to make sure they transition back into the workforce. But depending on what the criminal record is, there's also significant barriers there as well. And then there's, of course, people who just choose to be homeless. With the Gabby Petito case in the news not that long ago, everybody's talking about that van life trend. With the high cost of housing, there are a lot of folks who are living in this kind of lifestyle. And while HUD says, okay, if you're living in a car, you're homeless, people are choosing that lifestyle as a way to save money. They're being very creative about it. There's some folks on YouTube you can actually watch who are documenting their lives living in their car, where they have a gym membership and that's where they shower in the morning. They might have friends who can help them out with the resources, but otherwise they've retrofitted their vehicle to make it comfortable for them to live in. The big one here is that you can disagree with it, but it's not unlawful unless they're trespassing. And in these situations, all you can really do is say, if you guys decide you want to exit the situation, we're here. But if it's lawful, you just live and let live. Some of the other less common situations that we see, and there's one that's come up about once a year for us, is children, typically teenagers, who come out on the LGBTQ spectrum to their parents. They just kick them out. Luckily, there are resources in Charleston. There's an organization in Charleston that specifically helps individuals who have been kicked out of their home because of that. So we're very grateful for that, and we don't want to follow up with them in those circumstances, but at least once a year that comes up, and it's very unfortunate. Are there any other examples you can think of, Fred, of kind of some of the offbeat?
The traumatic brain injury issue is something that doesn't pop up very often and is a really tough one to resolve just because there's not a plan in place. What we're being told by the folks in the state is that just as there is a commission for the blind, there is a commission for traumatic brain injury. But what we're being told is that they have been, quote unquote, studying the problem for about 26 years. So obviously we're going to have to come up with some local solutions for ourselves for that population.
Yeah, traumatic brain injuries are definitely a gap in the system. Because a person with a TBI may exhibit symptoms of mental illness, but because it's an injury, there's no medicating it. There's no brain chemistry to correct. It's an actual physical damage to the brain. It may influence their behavior, influence things like memory. I think that DDSN, as a statewide DDSN, is transitioning to accommodate that a little bit better. And I think it's because now that there's more attention drawn to this, and part of it's just mental health saying, hey guys, if we've identified a traumatic brain injury, they can come to us all day, every day, but there's no treatment for that. There's no medicine we can prescribe. You're talking about, you can't therapy that kind of thing away. I mean, it's an actual injury. So in terms of the overall housing continuum, now this is one of the new sections that I've added, and I think it warrants a little bit of time to spend on that. We have some pretty big gaps in the housing continuum. You can transition from homelessness, and this is a great little graphic. I lifted this one from the internet. I put a little asterisk there because I use the term social housing. So social housing in this context, it refers to public housing. So we're talking about housing owned and operated by the housing authority. So here you see homelessness, emergency shelters, transitional housing, and social housing. So that's really that housing continuum for people who are homeless or in unstable housing. The transition from there, specifically from our community, is that if you're homeless, pretty much your next option is single family detached. And nobody's making that transition from I have nothing to I'm going to buy a $400,000 house. There are limited affordable housing options. And when we say affordable housing, we're talking about housing complexes. These are privately owned complexes that have received some sort of tax credit or subsidy through the federal government, and they have to maintain a certain number of units that are rent controlled. But that is separate from the housing authority and Section 8. Section 8's a direct subsidy for housing. And even then, housing authority only has so many that they can give out. They have an allocation from the federal government, how many they can provide. And the need is probably always going to outstrip the capacity that they have, at least until such a point comes that we can demonstrate the need and then back it up. But in terms of things like affordable housing, and from there going to the right of that spectrum, there's not a lot that we as human service agencies can do there. We can advocate for it, but ultimately it's up to private developers. It's up to government administration. And when I say administration, really what we're talking about is county council. I know you guys are probably aware of the new penny tax that just passed for green space. Y'all, this is South Carolina, and people actually agreed to pay more taxes for something. If people are clamoring to limit development and to buy more green space, that's going to have an impact on affordable housing. Because what they're saying is, what constituents of Beaufort County are saying is, we don't want any more development, period. Affordable housing or not, affordable housing is already a NIMBY trigger for a lot of folks. I don't want to have that near me. But they're saying no to all development. And that's going to be a challenge because when these developers come in and they want to produce some sort of plan. If the constituency gets up in arms and says we don't want it, then they might just find somewhere else to go. And when you look at other developments, like look at Whitehall. They've been fighting over that for 10, 15 years, maybe even longer, until they finally agreed on development out there. So uh, it's frustrating, but there's not a whole lot of influence that we as human service agencies have over that process. So really, when we talk about the Residential Empowerment Coalition, we're looking at social housing and then all the way to the left, trying to figure out the solutions there. Because we're going to have to figure that piece out. And then we'll just have to strategize about affordable housing and everything else and think of some more creative solutions from there. In terms of shelters, we've looked into shelter feasibility. There are lots of different examples of shelters. Of course, Hopeful Horizons has the domestic violence or women's shelter here. There are youth shelters, there are family shelters, there are emergency shelters. At one point, Sea Island Presbyterian was operating the emergency shelter for Beaufort County, and that was the cold weather shelter. And I'll talk about that one a little bit more in a minute. And then, of course, you have your prototypical homeless shelter. Now, the image that I use there, that's an emergency shelter. That's the emergency shelter that was implemented in Columbia for a little while. In terms of emergency shelters, now, if we have a hurricane, the state will open emergency shelters in collaboration with Red Cross. Those are typically operated out of school gymnasiums or school buildings. They are, of course, temporary because once everybody moves back, the schools want to reopen as quickly as possible. So those are definitely not a long-term solution. And that's a big challenge for us because if someone's house has been destroyed in the course of them staying in that emergency shelter, once the school wants to reopen, we're going to have to figure out some place to get them situated. Regarding the inclement weather shelters, the Red Cross is the agency that authorizes this. The Red Cross has to call, in this case, Sea Island Presbyterian Church. They would call them and say, hey, temperatures are going to drop below a certain threshold. We're authorizing you guys to open this. We'll make some resources available. But usually they have a roughly 24-hour notice or less, which made it very difficult for them to get the news out to say, hey, if you guys need shelter, come on out here. And the outcome for that is that it was always vastly underutilized. They ran it for several years, and I'd say for several years they had at least like 3 or 4 individuals. I think the most that they ever had was 8 at any one time. And Barbara Thomas was running that up at the time. She's the interim director now for Lake Country Habitat. So if you have any specific questions about that, you're certainly welcome to call her. She was kind enough to give us a little bit more insight at the last Residential Empowerment Coalition meeting on that, but she was responsible for operating that. In terms of your prototypical homeless shelter, there's lots of different models for how these operate. Most of them in urban communities, they're overnight only. And so they might lock the doors at 10 o'clock and then open the doors at 6. And so you're talking about a 10 to 6 shift for whoever's working. And that might be across 2 shifts. They have stay policies put in place, which means they're going to keep track of who you are, how often you've stayed, and they're going to limit how often. Like if you get there for 3 or 4 days, they might say, okay, you got to go. We can't keep you here anymore. They are extraordinarily expensive to operate. I think it's also worth noting that shelters like that, they're only available to adult men and women. And in many cases, it's usually one or the other. It's either women or men. They are not designed for families, and they will not allow children. And because of that, they're often very unpalatable to the individuals who are seeking shelter. And when I was doing some research on this, I was really interested when I read about the shelter in Columbia they ran, the cold weather shelter in 2019, and that's the one that's pictured there. The newspaper interviewed a few people who stayed there, and they were basically like, no, I don't want to go back. Like, it was awful. Like they're like, I'd rather be homeless than go spend the night there. And really what you're looking at is people who are making decisions. It's like, if I'm going to be cold and miserable and do it on my terms, or I can go be warm but still miserable and do it on somebody else's terms. And for a population that's already very fiercely independent, I mean, that's not really a choice. It's like, no, I don't want to do that. So despite having spent a lot of resources and time and energy on putting that together, the target population overwhelmingly did not enjoy it. Now, if we were to start up a shelter, the startup costs are pretty high. We're talking about $500,000, and that's just a rough estimate. And I say 20-bed facility, what I'm really thinking is like a 5-bedroom house. And we're talking about 4 beds per bedroom. And that's really packing it in. We're talking like 2 bunk beds. Depending on the nature of the house and layout, it may be a 10-bed facility. But either way, you're still talking about $400,000 for the purchase of a home.
Ben?
Uh-huh.
You have a question from Ann. She's asking, what are resources are currently available in Beaufort County with regard to emergency shelters, transitional and social housing? Are these services funded locally and federally?
So in terms of social housing, you have the Beaufort Housing Authority, and all of that's federally funded. I've got a list somewhere of inventory of how many units they have now. Now, the difference between Section 8 and public housing. So the Housing Authority actually owns and operates public housing. They're the landlords for the public housing. And then Section 8 is just a direct subsidy. So if you have a Section 8 voucher, you can live anywhere in terms of, we're talking like a market rate housing if they accept those vouchers. And the federal government will actually subsidize their rent directly to the landlord. So that's the other alternative they have for that. In terms of emergency shelters and transitional shelters, there are different options for different target populations. So if you have a substance abuse issue, there are halfway houses. But there are no just generic across the board like emergency shelter if you're experiencing homelessness, and that's a big challenge that we have. Now if we have a natural disaster, Red Cross will open up a temporary shelter and things like that, but there's no just like standing emergency shelter.
Our closest is what, Walterboro, and then Savannah and Charleston?
Yes. Yep. And I only just learned about the Walterboro one very recently, so I don't know any information about that.
I'm sorry, I may have missed it. Did you already mention like the Mercy Me and Rooms of Grace, Hope House, those kinds of facilities?
Yeah, those are all alcohol and drug related transitional shelters. I think some of them have emergency shelter components. I believe Rooms of Grace will accept that, but some of the other ones, there is a qualification period to get
And
in.
you have a question. What is the process for Section 8 voucher, and where do we refer people if they need one?
So they open up Section 8 applications, and I don't know what the frequency is, but they'll send out an announcement.
I think it's just periodically based on the waiting list.
Yeah, I know. It's usually like once or twice a year we'll get a notification that says, "Hey, we're opening up applications." That is all through the Beaufort Housing Authority. They're the ones who process those applications. But Section 8 vouchers, those are the ones that are that's the federal subsidy, and they give the Housing Authority so many vouchers, and so they can only provide that service to so many individuals at any one time.
Anna just posted the link to Beaufort Housing Authority. I think the key there, I think Cassie was the one who asked the question. I think the key there is to make sure you understand that there is a waiting list. So what I find is people will find out, oh, there's a 2-year waiting list, I won't bother. No, bother, because you need to put your name on that list so that when your name comes up, you have that opportunity. If you never get your name on the list, it's never going to happen. So what we encourage people to do is to contact the Housing Authority and make application, even though there may not be an opening right now. Do it anyway and get your name on that list.
Absolutely. Regarding shelter models, so if we were to operate a shelter here, realistically, the only model we would want to operate would be the 24/7 model. And this is one where you provide housing overnight, but then during the day, rather than closing the entire shelter and pushing everybody out, you'd continue to provide services to individuals, transportation, things like that. Uh, but if you're running 24/7, then you're talking about first, second, and third shifts. So that's a lot of payroll. Um, and we'd be looking. This is a very
Conservative.
generous. Yeah, I would say this is a pretty generous estimate. I think it would probably be a little bit more than this, but this is one. This is actually uh, the previous slide was a guess. This one is actually modeled off a 24/7 shelter, I think out of Maryland. And I can't remember where I where it was exactly, but I was able to find their budget, and it was a small like a 10-bed facility, I think. So I said, well, I'm gonna just use this as an example because this is what their actual budget is. And it was $426,000 a year. So the overarching goal is to achieve what's called functional zero. And this accepts the reality that you'll never eliminate homelessness completely. There will always be people entering and exiting homelessness. There will always be issues like job loss. There will always be issues like natural disasters. There will always be issues like mental illness. But the goal is that you have a continuum of care, and referring back to that housing continuum, where you can move people from all the way to the left side of that, where they're actually, you got the little tent image, all the way to affordable housing, or just sort of long-term sustainable housing opportunity. And this kind of ties back into, if we were to have a shelter, I want to point out that nationally, 50% of all shelter bed nights are used by 15% of the population staying in shelters. So what you're really doing is for lack of a better word, they're warehousing homeless individuals. They're not moving anywhere. They're not moving through that continuum. They continue to be homeless, and they continue to live in those emergency shelter situations. And for those that have a limited stay option, they just move to another shelter and they do their 2 weeks there, or whatever their limit is. They move to another shelter. They do their 2 weeks there. Because when you're in that situation, your priority is going to be Maslow's hierarchy of needs. If you don't have shelter, your priority is to find shelter. If you don't have food, your priority is to find food. So there's no time. Everyone's like, oh, well, they can just, go get some job training. There's no time for that, because your entire day is spent trying to find, where am I going to sleep that night? And that, taking back to the feasibility of a shelter, if we had a shelter and we filled it immediately with 10 or 20 individuals, but we can't transition them out effectively, then what we're really doing is spending $400,000 a year on 10 people. And for that matter, just give them jobs. You're paying $40,000 per person. We could just give the guys jobs and get them squared away. But if we can coordinate to a point where we're transitioning people, where they're in a shelter for no more than 2 to 3 months, and you can help 50, 60, 70 people in the course of a year, then it's absolutely worth it, because you're able to move people through that continuum, provide services effectively, holistically. And that's how you achieve that functional zero point, as where, as a person exit homelessness, you have someone else enters it, and you just continue to move them through that process, help them with whatever needs they have. If we're talking about someone who's profoundly disabled, DDSN, or some sort of permanent supportive housing, mental illnesses, permanent supportive housing, home share programs, things like that. There's opportunities there for anyone experiencing whatever along that spectrum, but we've got to be able to move them forward. We can't just keep keeping people in emergency shelter. And from a community standpoint, a shelter seems like the easy solution, but once it's full, it's full. And if people are entering homelessness faster than they're exiting it, then you're still going to you're back to square one. You've got a full shelter, and then you still have somebody in front of you saying, I'm homeless, what do I do? And now you can't say, we'll go to shelter, it's full. Just want to provide some information about from Charity Tracker. So for those who aren't super familiar with Charity Tracker,
Ben, let me interrupt you for a second.
Yep.
We got 2 comments that I want to draw everyone's attention to. Connie reminded us that we have vouchers that are specific to veterans. So if you're dealing with somebody who is a veteran, there is a housing option specific to that population, and that you get that again through the housing authority. And then in terms of an emergency shelter or short-term shelter, we need to mention that Family Promise is a unique church-based family shelter model, and they provide services for families. So as Ben mentioned, most shelters will be for men or women. This is an option that will allow families to stay in their facility.
yes, thank you. Charity Tracker data from 2020. So Charity Tracker, in terms of how Charity Tracker works. So all of these individuals are people who have self-identified through one of our partner agencies, and they have said, hi, I'm homeless, I'm looking for services. Do you guys have anything you can help me with? We're pretty confident that there are significantly more people experiencing homelessness than what's reflected here, but there are a lot of folks who aren't seeking help. They might just be making do, or they're too proud to ask for help. I think one of the most interesting statistics for me from Charity Tracker is that about 80% of the requests for help are from women. Very few men are coming into Charity Tracker as the head of household and saying, hey, I need some support. The head of household is 84% the mom in that family saying, hey, is there anything you can do, because we're having a hard time. So there are a lot of men who experience hardship who are just too proud to ask for help. In this case, for 2020, we had 100 adults. These are people aged 19 to 64. And when you expand the search to include those who are imminently homeless, and that includes folks who are living with a friend or family, or folks who are facing eviction, you're looking at 656 individuals. So significantly more individuals are facing homelessness. They're one bad day away or 30 days out from eviction if something doesn't change, from moving to that orange square there. And there's a lot of children included in that. Again, these issues disproportionately affect younger families, and it affects children. For 2021, we saw 17 children, 100 adults, and 9 seniors, about 525 overall individuals experiencing imminent homelessness. That's about 204 different families. In terms of data, this is a slide that I added recently. We know how many, but we don't know the who, what, where, and why. And this is a big challenge for us as it relates to strategizing solutions. We know that mental illness is a problem. We know that addiction is a problem. What we don't know is how many, and what's the comorbidity. We can't, we have that rough outline. We need to start painting that picture, because if we can get more information, then we can start implementing some better solutions. We know that there's a lot of individuals experiencing homelessness who have straight up refused services, whereas there are a few others that are participating in programs now. We don't know where they are. We know anecdotally where to find them, but again, we can't say we know exactly that there are 20 individuals at Waterfront Park. We don't know exactly that there are 50 or 60 individuals living in motels. We just don't know. And then in terms of barriers, again, we just don't know, what are those challenges they're experiencing as to why they're homeless? What are those barriers to get them out of homeless? We know broadly what they are, and we know what the challenges could potentially be, but we're trying to get to a point where we can tell you exactly how many individuals are experiencing what barriers. And that's going to help us be a lot more effective as it relates to grant writing, as it relates to determining what our needs are, and informing interventions and policy.
Ben, I'd like to make a comment on that last slide when you talked about people refusing services. The population that we're talking about, and the population of human service providers in the community, what we're finding is there's basically two schools of thought, and that is where we have some confusion. You have one part of the human service population that believes that individuals, adults have agency and they have a right to make decisions for themselves. You have another school of thought that says, yes, that's true, they do, but if they were given the right rapport, building a relationship with someone, you may be able to convince them to change that thinking. But the fact that those two schools of thought are coexisting in the community is, in my book, is part of our problem, because we're fighting against ourselves. We need to decide how are we going to handle that situation. Ben talked earlier about people who have been incarcerated. There's going to be people in this population that we are not going to be able to address. If you're violent, no shelter is going to take you. So incarceration is the only option. If you're somebody who is violent, then there's not another option for you. So I think part of the issue there is we have to be willing to, once we understand the data that he's talking about here, we're going to have to be willing to make some hard decisions, and come to a place in our collective decision making that we decide, here's how, this is the population we're going to be able to address issues, and this is a population that we're not going to be able to address.
Yeah, thank you, Fred. Yeah, that's an important point. We get a lot of calls from concerned citizens like, what's available for this person? And I tell them, I said, guys, I can guarantee you, for someone who is visibly homeless like that, they have been engaged by law enforcement on some level. And our law enforcement is really trying to help individuals. Law enforcement officers, we have a lot of law enforcement officers who know these folks by names. They interact with them on a daily basis. They check in on them. The thing is, if they're on public property, it's legal. If they're not doing anything illegal, they can do whatever they want. And nobody can legally stop them from doing that, despite the fact that a lot of folks are concerned, or a lot of folks may be less concerned and more concerned about, how can we get them off of our, out of our sight too. That's the unfortunate reality of some of these calls as well. But if an individual refuses service, you can't force it on them. There's no legal way to force a service on somebody, with the exception of 3 agencies being law enforcement, and that's only if they break a law. If someone is in danger of self-harm, you can do an involuntary commitment, and then adult protective services can take someone into protective custody. But the bar for protective custody is extremely high, because as a nation, the same laws that protect our freedoms also apply there. From what I've been told by a lot of our colleagues, for adult protective services to take someone into protective custody, we're talking about somebody who is non-communicative or immobile or both. But basically they just have to be completely disabled and 100% reliant on another caretaker. In which case, in those circumstances, you're talking about a caretaker who is neglectful or abusive, in which case they would intervene. But for an individual who is perfectly capable of making decisions, if they refuse services, they have to walk away. They can't say like, well, I disagree, you're coming with me.
Yeah, even if the decisions they're making are ones that we as reasonable adults would say that's not a good decision,
Yeah.
that's irrelevant.
And those decisions include not taking medicine. If
Right.
someone chooses not to take their medicine, they have that right, which is a big gray area in terms of human services. But you can't shove a pill down somebody's throat who doesn't want it. You just can't do that. I also want to talk about barriers and strategies, because a lot of folks spend time talking about barriers that we just can't change. We can't change the global economy. We can't easily change. I don't think there's anybody here in this room right now who has any sort of influence over federal policy or federal law. If you do, call me. We need to have a discussion. And then like the case with and I just forgot the name of the apartment
Chimney
complex.
Chimney Cove.
Chimney Cove. Chimney Cove, that's private sector. It's cruel, it's horrible, but it's legal. And that's the downside. We can dislike it all day, but it's still happening and we're still going to have to react to it. So but the time spent being frustrated by these things is time that could be better spent talking about what can we implement, what do we have influence over, what can we change tomorrow. Things like local policy, and I put specifically government and non-government organizations and nonprofit organizations because all of them have policies. And if you're the executive director of a nonprofit and you're complaining about a policy of your own nonprofit, you have influence over that. You can chat with your board. Those are things you can change. And people need to realize that if there is a challenge and you feel like you have any sort of ability to address that, do so. That's going to help. Making sure we're all talking on using common terms, common language. We have a common understanding of what we're up against. Targeting populations. Now, there are some communities that have achieved functional zero, but they've achieved functional zero for a target population. I think Anna and Danny did some research on this. So those communities that have achieved functional zero have achieved it for veteran populations. So they have made sure that there is always opportunities for veterans in that community to receive some sort of services, and that continue effectively provide services to move them out of homelessness. So some of it could just be, okay, we need to bite off what we can chew and say, okay, we can't fix homelessness as an issue overall, but we can fix homelessness for one population. And then that's one piece of that we've addressed. Things like training, public education campaigns. I can tell you, I've been very impressed. The public is doing a great job at educating themselves about these issues, especially as it becomes more and more visible. I do like to keep an eye out on social media to see, whenever an article gets posted about homelessness, what's the community response. And the responses have really changed over the past 5 years. They are considerably more compassionate, considerably more focused than they used to be. And that's good for me to know, because it lets me know, like, what's the pulse in the community. How are constituents feeling about this? How much interest is there from the public to addressing the issue? Because that's going to influence how we interact with the public as well. Donor engagement is going to be a big one. If you can convince donors that this is a issue that needs to be addressed, because typically donors want to go for those easy feel goods. We're talking about children, families, things like that. This is not a popular population for donations, just in general. But if we can convince them, like, guys, we're not just talking about your stereotypical homeless. When you think about a homeless guy, we are talking about families. We are talking about children. This goes a lot deeper. We're talking about veterans. We're talking about people with mental illnesses. We're talking about people who are vulnerable. That's going to give us the opportunity to redistribute some of those resources. And then the last one, this is one that people get very upset by, is just the very concept of relocation. Bottom line is, for our department, it's making sure that people are taken care of. And if they can't live here, then they can't live here. And I want to make sure that we don't hold individuals hostage to our community's economic situation, especially when you look at people who have a fixed income. If you're on SSI, SSD, something like that, you're getting $1,200 a month and you can't live on that here. You need to find somewhere that you can, because you're only getting $1,200 a month. That's not going to change. And so I think, and a part of that is just pride. It's an embarrassment. We don't want to be a community that can't help individuals. But if we can't help them tomorrow and they need help tomorrow, then we need to look at opportunities where they can get that help tomorrow. Because I personally don't like the idea of saying, we'll just be homeless a little bit longer and we'll figure it out. Like, we need to make sure they're taken care of.
I think a important piece there is for folks to know the difference between the amount of money it costs to live in Beaufort County. The last number we looked at was $19.67 an hour. You have to earn $19.67 an hour in order to be able to afford to live here. Well, then you look at what the average wage earned is in our community, especially if you look specifically to the food and beverage, the tourism industry, what we pay that population of workers, it's closer to like $13 an hour. So it's no wonder people can't afford to live here. And the bottom line is, if some of them are not in a position to change those circumstances, and we can't find a way to mitigate those circumstances, Ben's right. The bottom line is they just need to make a decision as to whether or not they can afford to live in a community that has one of the highest cost of livings in the nation. I think we're equal to Atlanta. You know, a little community like Beaufort County having a cost of living at that level. So I think he's right. We're just going to have to acknowledge the hard, cold facts of what life is like here.
Yeah, except we don't have public transportation, so you have to also have a car. Because you have to have a car if you're going to get anywhere here. You got to have a car. There's not a lot of walkability for jobs. Whereas at least in a city, there's opportunities possibly to live very close to where you work, where you don't need a car. You don't need a car payment. You don't need to pay for car insurance, and that also frees up income that can be spent for housing and other things. So this is the part where this is before we had Anna, and now I'm going to kind of awkwardly talk about Anna in front of Anna about what Anna is supposed to be doing, and we've had to do this a couple times. But so in terms of solutions that we're trying to implement in our department, we have gotten approval from county council for an outreach specialist. In terms of what we're immediately looking at doing, Anna is serving as that primary point of contact. We're trying to transition all those calls to come into Anna. So she can help with that resource navigation, data collection, and then identifying what those barriers are. Because if she, as Anna interacts with these cases, she's going to get a better understanding of what are we up against. She's going to be able to record this stuff, and that's going to give us a lot more to then take to county council or state legislature. Whoever else needs to be involved in this conversation to say, okay, guys, we know that the problem, but now we're going to tell you exactly what the problem is. We know what relevant laws could be changed to influence this problem. We know what challenges we have as a community that can influence this problem. That's going to make it a lot more effective to have a conversation about change than just generally knowing, okay, homelessness is an issue. To be able to pinpoint what those issues are exactly, and then formulate recommendations, actual tangible recommendations that people can implement with relative ease. I'm thinking like, okay, here's something you could change within the next 6 months that would make a difference. Even if it's a small difference, if you add 5% difference here, 10% difference there, if you add a lot of those, you finally start to make an impact on those issues. In terms of midterm goals, and Fred talked about the Everyone Count event at the through Continuum of Care. Over the next couple of years, we hope to eventually have a coordinated entry system where everybody in the community is coordinating through our department, through Anna, in a established process to record that information, get everything we need to make recommendations to individuals experiencing homelessness, and then to transition them to that next stage, find whatever services they need. We're going to be implementing a HMIS as a homeless management information system. We will either do this through the official HUD HMIS, or Charity Tracker also has a HUD compatible HMIS feature. So we're in the process of doing some research on that to see what would be the easiest way to implement this. That's going to give us a actual mechanism, actual database to record all the relevant information for homelessness. Charity Tracker has that. It would be a lot of narrative stuff. So this gives us a little bit more opportunity to quantify, more easily quantify what those challenges are through that HMIS component. And then, of course, if we have that annual point in time count with HUD, that's going to give us another tangible quantitative tool to then go back to Continuum of Care, to go back to HUD and say, okay, guys, this is exactly how many people in the middle of January, exactly how many people we have who are unsheltered, and empowers us to then say, okay, and we need to ask for funding proportional to that population so we can begin implementing services. If we're ever going to have a shelter, it's going to have to be funded by HUD. And if we can get to a point where we can actually quantify that and request a significant amount of money to offset the cost of the shelter, then a shelter becomes a lot more feasible for our community. So there is definitely a clear path forward. We just have to make sure we get that information. And then, long-term goals, eventually we'll have enough information, we can start leveraging some grants, federal grants, state grants, private grants to help these populations. We can make some recommendations to policy changes. We can support community grassroots efforts. Yeah, so the county would not be opening a shelter. We would need to have a private nonprofit partner who is going to open the shelter. The county will absolutely support it. There's grant opportunities through the county. There are opportunities for us to support a private partner, but we cannot be the ones to do it. A lot of people say, well, they should just take care of this. And when they say they usually they mean the government, or this other nebulous they that just basically means it's not me, it's someone else. But everybody looks at us like, why doesn't Beaver County just build more affordable housing? Well, we're not actually building the housing. Developers are building the housing. Private companies are building the housing. It's just zoning, planning, all those departments are involved in that process. And I don't know how that process works because that's not something I've been trained in, but if we can get some folks to get that funding, get that support, private donations, you have match opportunities for federal grants. If we can support those efforts, then we'll see a lot more progress. And then, ultimately, even though it's a moving target, the goal is to achieve functional zero, to where people are exiting and entering homelessness at that same rate.
Ben, Sheila Cornwell just wanted everybody to be reminded that the South Carolina Integrated Data Warehouse exists for data needs. So if you're working on grants, don't lose track of that as a potential resource to help you with identifying data.
Yes, thank you, Sheila.
Great. She just put thanks, Sheila. She just put the link in the chat so you can pull that up.
Yeah, that's great to know. Does anybody have any questions, comments, concerns, criticisms?
While we're waiting for folks to unmute themselves, if they have questions or comments, I'll note that Summer Roberts with USCB said that she's going to follow up with you because she found the presentation extremely interesting and she thinks that both her students could benefit from it and help inform it. So she'll follow up with you later.
That's great. Yeah, Summer's been a great partner. I've done a couple presentations with her and her students, so I've really enjoyed working with her.
Anyone else? Questions or comments? Wow, I think that's the first time you've given that somebody hasn't jumped in with a concern. But what about? Sorry, my phone's ringing.
And and I'll let you know that the information in that presentation, I'm being very very clear. When I work with people from the public, when I get calls from people in the public, I'm taking that time to spend explaining this because I found that it's been having a pretty big impact. I've had a couple calls from people, especially in the city of Beaufort, in the downtown area, with concerns about people who are experiencing homelessness. And I've talked them through like, okay, let's talk about it. Let me tell you what the challenges are. And let me tell you, what your options are as a citizen to report this. And the response to them being educated by this has been really, really positive. And in several cases, I've had people say, oh, I'm going to take this information to my homeowners association. And I'm like, well, that's pretty cool. It was a 15-minute conversation. I just covered a whole lot of people, as far as educating them about how this works. Because a lot of folks, they look at it like, there's no way this person wants to live like that. And they just haven't been informed of the opportunities. And, it's possible that that's true. But a lot of those folks who are very visibly homeless are still making a choice because in overwhelming number of those circumstances, the choice is I can do things the society way or I can do things my way. In which case, there's no easy solution. And when people are faced with the reality that changing them may mean they're being forced to do something they don't want to do, they kind of backpedal a little bit and they're like, well, I don't want to get them in trouble. I don't want to get APS to take them in. And well, that's, they're going to have to make a choice. They're going to meet us halfway for some of these things. All we can do in some of those circumstances is just be available. And I can tell you, I think probably one of the most frustrating things with this is that every once in a while you get a call from somebody who's like, I'm homeless and I just had a horrible experience and I'm ready to get out. And when you get that call, that's your opportunity, to really make a difference. But if there's nothing available at that time, then they're gonna say, you know what, actually we figured it out. 2 or 3 days later, there's been no support, and now I'm good. I'm good. Don't worry about me anymore. So it's really heartbreaking to miss those opportunities when somebody reaches out, they're ready for help, they're ready for that change, and then you didn't have these services available for them at that time to engage them. But we're hoping with Anna, and if we can get some resources available, that when those opportunities do come up and these individuals say, hey, you know what, I know you guys are out there, I finally decided I'm ready to get out of this, that we're available and ready to support them in that endeavor.
Ben, two things. One, you're talking about the people that don't want the help. I think it's important for all of us as human service providers to be aware of that, so that not so that you can, be on the lookout for people who are trying to scam, but there's times when we've had people that have come to us. I had a woman come to me one time and she said, I'm homeless, I need help. I gave her a list of like 5 different local resources that she could tap into. And she said, I went to all of them and none of them would help me. And it wasn't until I followed up with those organizations to find out that she was an active meth user and she wasn't willing to stop using meth. Well, yeah, there's not going to be a shelter that's going to let you move in and use meth. So like he said, like Ben said, it comes down to they're making a choice as to what they want to do. And I agree, I understand there's ways of working with that population, but that takes time and you have to build a rapport in order to be able to bring that person along, which goes back to the earlier point I made about those 2 schools of thought. Also, Jessica Beasley has asked about resources that are available for guidance. The best thing I can point you to, but Jessica, is 524-HELP. 843-524-HELP. It's the United Way helpline. It's the best way to be able to tap into all the different resources that are available in our community. It's better than a 211 call, in the sense that if you call 211 and you say, I need help with my light bill, they're going to give you a list of 4 or 5 agencies in your area that will help with a light bill. That's it. You're going to get name and phone number. If you call the helpline, you're going to actually be walked through an assessment process. So many of the people who call us with help and say, I need help with my light bill, when you really start to get into what's going on and looking at those underlying causes, okay, we're going to give you the $50 for your light bill, but what's going to be different next month? Do you need a better paying job? Do you need to get a GED? Do you need to get help with mental health or alcohol and drug? All of those things can be accessed by going through the helpline. They can connect folks with all those different resources. So absolutely, the number we want to get out in the community is 524-HELP.
So I'm going to jump in on that,
I
Fred.
was just going to say, Ann, do you want to add anything there?
Yes, sir. And so that's the 524-4357. And if it is nights and weekends, you also have the 211. You can now text them. And if you text 211-211, say you need food or electricity, you just text that one word and it's going to ask you for your area code. You put that in and it's going to give you that information in your area for when we are not here. But we do have a full-time helpline staff that answers the phone all day long.
What hours does the helpline operate, Ange?
Typically, it is 8:30 to 5. During the summer, that's Monday through Thursday instead of Monday through Friday.
Great, thanks.
Mhm.
Carrie Major wants everybody to remember that the Beaufort County Youth Conference is coming up on September 24th. It'll be a virtual meeting at 10 a.m. for middle and high school students, and she's listed a phone number there to register.
Yeah, thanks, Carrie. And I do have that in the newsletter as well. I put your flyer in there.
Jessica's asking for Angela's email. Ange, can you put your contact in the chat? Anyone else have any questions or comments before we move to the last agenda item of our announcements?
And also, just real quick, if you guys found this helpful, if there's anything you guys think I should add to this, just let me know. This has been our all-purpose presentation for educating folks about homelessness. We use this for government officials and the public. So if there's anything else you guys think I'd like to cover, anything else you think I could make additions to, feel free to just email me, call me, let me know. We can talk about it. And I just want to make sure this is as comprehensive as possible.
Thanks, Ben. Great presentation. All right, and unless anybody has any last comments or questions, if you do, hurry up and hit something in the chat just so I'll hold up and give you a chance to ask it. Angela has posted her email address on the chat as well, so you're welcome to get that from there. All right, looks like we are ready to come up to the last section. So what we're going to do is this is where we typically go through and allow anyone who's on the call to make an announcement about your organization. I will give you a couple of caveats. First of all, almost everybody here is a nonprofit, so don't talk about your fundraiser because these are all folks who are operating their own fundraisers. So we limit that. And then also remember that if we got, what are we up to, 26 people on this call, if everybody takes 5 minutes, we're going to be way too long on time. So keep it brief. And so what I would ask you to do is, if you have an announcement, rather than me go through the list of everybody's who's here, if you have an announcement, just put your name in the chat and then I'll call you in the order that they've been listed in the chat. So if you have an announcement that you want to share with the group, something that's relevant to maybe a new service that's being available through your organization, if you have a question about other information that you've heard, just put a note in the chat. So I'm going to give you about 2 minutes to see if anybody wants to ask any questions or make any announcements.
So while you guys are putting stuff in chat, so I was reading the news this morning, and apparently Savannah has a new outreach team. It's the Savannah Homeless Outreach Team. The acronym is SHOT. And I was looking at that like, did nobody look at that like, hey guys, if you're homeless, get shot? Like, come on, guys. If you want an example, like, this is why diversity is important. If it was in the news, I'd have thought it was an Onion article for sure.
All right, we have an announcement from Connie. Connie Hip, that is.
I just put it in the chat so that you could do it there. We have, we're distributing the resource guides that Beaufort County has published a second version of it. If anybody needs any, reach out to me and I'll do what I can to get them to you. Thank you.
Great, thanks, Connie. Anyone else? Last call. Announcements. April, go ahead. You're muted.
Good morning. I just wanted to introduce Rachel Floyd. She is our new family aide with our home visitation exchange parent aid program. So we welcome Rachel, and she will be in Triple P training the week of September the 12th. But she has been wonderful since July 1st. We've gotten a lot more new families, and she's done a lot of home visits and attending COSI and UST and FDT and getting familiar with Charity Tracker and so on and so forth. So she's diving right in, and we're so proud and honored to have her.
Great. Thanks, April, and welcome, Rachel. And for those of you who aren't aware, Triple P is the Positive Parenting Program. Excellent, excellent model. All right. Anyone else? Last call. Oh, Cassie. Okay.
Hi. Sorry, I'll give you my face. Two things I want to just make quick announcements. One, we were awarded one of the 10 South Carolina Free Clinic Association clinics to be a part of a new grant for a community health worker. It's a brand new program through AmeriCorps, and we're so excited to be a part of it. We already have our students, a pre-med student that's going to be getting this certification. I don't know how it's going to work, but she may find herself reaching out. I'll make sure I have her on the next meetings. But I just want you guys to know that's happening. It's a very new program to both AmeriCorps, South Carolina Free Clinic Association, and us. So be patient with us, but we're real excited to what this could offer our clinic and our patients. And the other announcement is if you're a part of the chamber and you do Coffee with Colleagues, we have a big event coming up November 4th in the morning with Coffee with Colleagues hosted by Beaufort Memorial. But it's going to be an opportunity it's going to be set up in our parking lot. Planning is still underway, but it will be an opportunity to tour our clinic on a Friday morning. And we love having people through. Also, the lending room will be a part of that, and Access Health. So we want to make sure that everybody's a part of the chamber that takes advantage of learning about these programs. Thank you.
Great. Thanks, Cassie. All right. Anyone else? Yes, Jessica. Go ahead. You can just unmute.
Hi, I was just putting a note in there that the Beaufort County Coalition is doing a walk for opioid overdose awareness for the today from 6 to 8 at Burton Wells Park. No fundraising. It'd be great for y'all to join us.
Great. Thanks, Jessica. All right. One more call. Okay, I don't see anything, so we will move on to the last item on our agenda, which is getting ready for our next meeting. So the next meeting is scheduled for November 30th. And as those of you who have been members for a while know, the 5th Wednesdays, there always turn out to be 4 of them in a year. And luckily this year, the way the cycle is going to work out, we'll have this meeting just after Thanksgiving, and the next doesn't happen until March. So we're going to get a break there through the holidays. Normally we have to cancel a meeting because it's like in between Christmas and New Year's or something. So this year we won't have to do that. We'll have enough of a break between it naturally that the next one will happen in March. So our next meeting, November 30th, and then the one after that will be in March of 23. Any last comments? All right. Thanks, everybody. Have a great the rest of your summer, and we'll see you next time. Thanks for coming.